Hi, welcome to Westfield State University. For those of you who I haven't met yet, I'm Dr. Michelle Duffelmeyer. I'm Director of Didactic Education here at Westfield. I'm an internist practicing for 24 years in internal medicine, but I also have an interest in travel medicine. This summer, I was lucky enough to take 2 students with me on a medical mission to Chulucanas, Peru. So we partner with Global Health Volunteers, which is part of Trinity Health. They have been making this trip to Chulucanas, Peru for over 30 years. We work with local partners in setting up a clinic. Our team includes physicians, OBGYNs, pediatrician, cardiologist, ER doc, myself, along with nursing and translators. The students who were interested applied to me internally, and what I was looking for in selecting students to come on this mission trip was maturity, interest, fluency in Spanish, a plus, and overall flexibility, because we have a lot of work to do and your role may change from day to day. When the students came on the mission trip, they rotated through doing patient triage, to rotating with each of the different clinicians, to then taking on their own patients with the help of a preceptor. On the last day of the mission, the pharmacy team had to leave early, and our PA students, being incredibly flexible and amazing as they were, took over and ran the pharmacy for the last day of the mission. Pharmacy is a big role here in the mission trip, as all patients check out through the pharmacy, and so they're literally seeing every patient that has come through during the day and discharging them with the needed medications, multivitamins, toothbrush, toothpaste, sunglasses, reading glasses, and providing all the services that we can here in Chulucanas. One of the best things about being down here on the medical mission trip is the teamwork. Not only the teamwork with our global health team, but our work with the local partners. As I keep talking about local partners, that's really community members that are volunteering their time, coming to Centro Pastoral and helping take care of the patients here. The friendships you make, local PT students you meet, the nursing students that you meet, all become part of the team, and the kindness that we show them comes back tenfold and really helps get the work done that we do here in Chulucanas, Peru.
Hi, my name is Melissa Knox, and I am a second-year Westfield State PA student. I was given the opportunity to travel to Chulucanas, Peru on a medical mission with one of my professors, Dr. Duffelmeyer, one of the guest lecturers we have here at Westfield State, Dr. Lou Durkin, and my classmate Maddie. So it's been a couple of months since we returned back from Peru, so it's been really great to look back on the lessons that I've learned, as well as the things that really has shaped me to become the PA student that I am, and that the PA that I'll become. And what's really unique about this trip is that it falls right at that midway point of your clinical year. So we start our clinical year in January. So we're going to these clinical settings and clerkships where we're getting all the skills and knowledge and interacting with patients, and then Peru comes along and it's 6 months down in your clinical year. So you already have a lot of your skill sets, and you take those things that you've learned and you're bringing it to another country. And Chulucanas, Peru specifically is afflicted and saturated with medical conditions and disorders and illnesses that range from acute to chronic that you don't see in the United States, because we have access to medical care and we have the resources, the treatments, the diagnoses, and the diagnostic tests that we're able to perform routinely in the United States. So as a PA student, you really learn in Chulucanas how to work with what you have with such limited resources. And it was pretty astounding because we were able to serve the community of Chulucanas, Peru, and give them the medical resources and really serve over 1,000 patients in just a short two weeks. So we worked alongside a lot of different providers, so pediatricians and cardiologists and OBGYN and internal med. And so as a PA student, you're able to work alongside these incredible doctors and utilize your skill set as a student and really see how we're able to treat these patients that do not have the medical care that we're so privileged to have in the United States. I know that I won't forget any of the patient stories, conditions, illnesses that I saw, but I also will never forget the community that we built alongside 30 strangers to take care of this one mission, and that's to serve the community of Chulucanas, Peru. So if you have the opportunity to ever go on a medical mission as a PA student or as a provider or even as an interpreter or a support staff, I highly recommend it because it's one of those things that will change your life forever. And I know that this has shaped me into a better PA student, and I know that I will carry this for the rest of my life. So yeah, thank you.
Hi, my name is Maddie Gatsunis, and I am a PA student from Westfield State University. This past June, I had the most incredible opportunity to travel to Chulucanas, Peru, to partake in a medical mission trip alongside a fellow classmate, one of our professors, Dr. Michelle Duffelmeyer, as well as her husband, Dr. Lou Durkin. There was a team of 30 that attended this trip that ranged from people all over the country, all different walks of life, all different professions, and together we gave care to probably over 100 to 200 patients a day during our 2 weeks there. This was the first time our program has ever been able to partake in any sort of medical mission trip like this, so it was a learning process to determine what our role as PA students was going to be during our time there. So we had the opportunity to work in a whole different number of roles, ranging from triage, so greeting the patient, learning about them and kind of determining where the best place, which provider would be the best for them to see, as well as working in the pharmacy, and also having the opportunity to even see patients on our own under the direct supervision of a preceptor. So during that time here, the learning experiences that we had, the patients that we were able to see and provide care for, so we were typically obtaining the history, doing the physical exam, and assessing the patient with the help of Dr. Durkin, and kind of providing a lot of patient education and just talking with people, providing a listening ear, and it just was one of those experiences that will kind of change your take on Western medicine, and just kind of for the whole rest of my career will stick with me. I'm really excited to take the lessons that I've learned into my future career as a provider. It was one of the most incredible experiences I've ever had the opportunity to partake in, and I'm really excited that this is going to be something that Westfield can incorporate moving forward.
Hey guys, my name is Dion. I am a pediatric nurse coming from Tampa, Florida. I'm here today with Global Health Ministries as a part of my healthcare system, Bayer Health Systems. They're the ones that sent me here. But yeah, right now we're here with Global Health Ministries in Peru, more specifically in Chulucanas, which is a beautiful town. We're seeing patients anywhere from 100 to 200 a day that are, some are coming from 30 minutes away and as far as 4 hours away, we've heard. Right now I'm counting antacids, more specifically Tums. We're also counting multivitamins, ibuprofen. There's antibiotics that are here. And we're seeing patients that are in dire need. Some with more acute illnesses, as well as those that are really sick, that have been sick for a while. Our purpose here is more or less to try to help serve them the best we can. They're very appreciative. And if anything, if you're interested in joining Global Health Ministries and their mission, please reach out to them. We could use your help. Yeah, thank you.
Okay, my name is Nancy Rodriguez-Weller, and I'm a pharmacist. I currently work with the University of Maryland Eastern Shore School of Pharmacy. I absolutely enjoy working with this population. I speak Spanish fluently, so besides the fact that I'm filling prescriptions all day long, I get a chance to interact with the people from Peru. I'm here with a pharmacy student, Tanya Estrada, and so far, I'm enjoying it.
This is my first missions trip, so I've always wanted to do one of these, so I got lucky that it was presented to me during a rotation of mine, since I am a last year pharmacy school student. So I actually am experiencing this for the first time. I'm actually really impressed on how humble the people are in Peru, and how much of a need there is out here. So this trip, for the little bit of time that I've been here so far, has kind of opened my eyes to see other things and giving me ideas for myself for the future.
My name is Lou Durkin. I am an ER doc out of Massachusetts. Yeah, this is my second time here at Chulucanas as an ER doc. And it's pretty straightforward. I really want to come where I'm very useful. You know, and even though you're kind of useful home in a place like this, they have such a tremendous need for basic healthcare, basic human supplies and needs that I feel like you could really make a much bigger impact. And I tell you, it's also kind of selfish because you come away with a lot more than you bring. I know I help, but it's such a good experience to be able to sort of get out of your comfort zone, come down to a place where it's a completely different language, and when you really start getting into it, you realize how much of an impact you can make. So again, it's a very fulfilling experience. I truly believe I get more out of it than the patients get out of me. So I plan on returning every year if I can. And where are we right now exactly? So we are in Chulucanas. It's a city in northern Peru, near Ecuador. And it's nearest bigger city is a town called Piura that actually has an airport. So that's about 45 minutes or an hour drive away from here. And this is where we come to do the mission trip. So we have our place set up about a half a mile away. But people come from all around. Some people travel more than a day or two in order to come see us at the clinic. It's really quite humbling. Thanks. You're welcome.
Yeah, okay, cool.
Yeah, so one of the things we do while patients are waiting, we put some fruit out. So the mandarins are more expensive, so they don't eat as much. So that's obviously high in vitamin C, and we take that for granted in the States, but some of them actually have low vitamin C counts, so the mandarins are good. Okay. The bananas are not like 1/10 the price, so everybody eats bananas, but they're still good, and I still like to have food out while people are waiting. Many of these people have traveled 6 to 8 hours. Some of them are local, but many of them travel hours, and I'm not sure what they've eaten. So before we're gonna do some exercise and stuff, I like to make sure everybody who is hungry has at least an opportunity. Also, it just says welcome. Welcome to our clinic, and we care about you. And sometimes they can wait 30 to 45 minutes to an hour, which honestly for them isn't a long time. But for me, if I have a patient back in the States waiting more than 2 minutes, there's a problem. So it's just a nice little thing we do other than the actual healthcare services. We also talk to them about proper nutrition at home. They don't have access to a lot of medicine, so food has to be some of their medicinal routine. And so just the oranges with the vitamin C, obviously that's pro-health. And then we talk a little bit about eating avocados. There may not be an exact concentration, but at least it's pro-nerve health. It's a good food to eat, and because a lot of their meals consist of carbs, just rice and not a whole lot of vegetables. So and avocados really aren't that expensive here either. So great. So my name is Dr. Thomas Everly. I'm a physical therapist, and I teach at the University of St. Augustine in Miami. My private practice in Fort Lauderdale. This is my 11th, 12th, 13th mission. And the reason why I like to come back is treating all of these people who should have access to healthcare and do not. So we provide services. Physical therapy includes nutrition, movement, posture, and manual therapy just to help get their pain down, get them moving a little better. We're only seeing them one visit, so we've really stressed the education part and how they can move better and how movement can affect their pain.
Okay, I'm Ellen Biggers, and I'm a physician OBGYN from the Berkshires in Massachusetts. And this is my 7th mission with Global Health Volunteers. And I'm here in Chulucanas, Peru, the town that we do our primary care mission. And we come approximately twice a year to do both primary care and surgeries for the poorest of the poor. We try to select people who are unable to access care without having the mission. So the locals, who are half of our team, select patients from the Sierra and from locally here in Chulucanas, and they're the ones who come and see us. People have both simple problems and actually very complex problems. We see children who have congenital anomalies, who need some sort of equipment to help them live a full life. We do also see people who have actually an acute problem going on. And we work as a team. We have volunteers that come from all over the United States, and some doctors, some students, some people are support staff, a lot of translators, and so that we can speak directly to the patient. We feel that that's very important, to use their words to tell their own story. There was once a case that I'd like to tell you about. We were at the end of our day, and we heard that there was a special case coming. And so we waited about 5 minutes, and a family was carrying their sister in a blanket. And so this was a large blanket, 4 men carrying this woman into the clinic. And she had a lot of edema. She was very, very swollen. And so we began to asked them questions, and it turned out that they had carried her for hours over the mountain to a small health post. And from the health post, they drove 6 or 8 hours to get to Chulucanas, and here then they carried her in. She had been sick for months. She was 19 years old and was very, very swollen. But as we were there, she was like eating, and she looked like she was like a mix of healthy and non-healthy. We did an ultrasound to determine that she was very bloated with fluid. She was not pregnant, which allowed us to eliminate some diagnoses. And then we found out that her kidney just was losing protein, nephrotic syndrome. Luckily, we were able to bring her to the hospital, and she was transferred to a larger center with the support of Global Health volunteers. The family was given a place to stay in the larger town of Piura. A patient was in the hospital for quite some time. This is a patient that even in the United States would have been put in the ICU and required dialysis. Her treatment was simple, and we understand that she is alive and well today. So it's just another example. The local volunteers put together a team very quickly for this woman, of an ambulance and support for the family, and we were able to really make an impact. It's small things like that in the United States might be easy to accomplish, but here it took quite an effort. And but the community came together with us to help this family.
Deposit Photos Music. Deposit Photos Music.
Hi, I'm Lou Durkin. I'm an emergency medicine physician, and I've been practicing in Springfield, Massachusetts for the past 25 years. I'm also a guest lecturer at Westfield State PA program, and I typically lecture on a variety of ER topics like acute coronary syndrome, stroke, concussion, and things like that. So I get to meet the students in their first year, and then I get to see them occasionally in their second year rotations when they're out in clinicals. This year, though, we went down to Chulucanas, Peru on a medical mission trip, and were able to take 2 PA students with us. So that was an incredible experience. I got to precept for a full 2 weeks. And while down in Chulucanas, we get to see some amazing patients with pathology that you just don't see in the United States. We saw hypertensive emergencies. We saw DKA that had been going on for months and months, maybe even longer. Typically, you wouldn't see these things to the extent that you would down in Peru. We take care of the poorest of the poor, and the students are a critical part of the team. This was the first year in 3 since the beginning of the pandemic that we got to go down. So there was typically a tremendous need, but after 3 years of no mission trips, it really was just overwhelming. We were supposed to have 10 providers with us, but only 6 were able to go. Therefore, the PAs became working members of the team. So talk about learning how to swim by jumping into the deep end. This was definitely that. They at times had their own line of patients. I was going between them and seeing patients on the side, just trying to move through and see everybody. People were really good about making sure if we had any interesting cases to get the PAs and bring them in. I was the procedure guy, so if it needed to be stitched, cut, etc., I would usually do that with the PAs. We had an ultrasound, a portable ultrasound, so we were able to see and do things with that we otherwise wouldn't be able to. We interpreted our own x-rays, usually just reading them out in the sunlight as our radiology box. And even though it was a lot of work, most days were there until 8 or 9 at night. We would then go to dinner, we'd debrief, we were able to have a decent amount of fun, but we would talk about the interesting cases of the day, which made it an even better learning experience for everybody, myself included. And the thing I just keep reiterating and telling everybody, we really do help a lot, we bring a lot, but everybody that comes down on a mission trip goes away with a lot more than you gave. It's such a fulfilling trip. I highly recommend it to anybody who can go.